Truth Will Not Be Silenced, the show that allows people to be seen, to be heard, and to be human. I'm your host, Melissa Woodfork White. In today's episode, we will talk about healthy breathing, myofunctional therapy with Karese Laguerre. Sharing our stories allows us to encourage, inspire, motivate, uplift, and help people. There will be a special surprise at the end of the show. Be sure to listen all the way through for the details. Our special guest today is Karese Laguerre. She is a graduate of the University of Medicine and Dentistry of New Jersey. She is a registered dental hygienist and myofunctional therapist. Karese founded the Myo Spot, a practice aimed at amplifying oral wellness to whole body wellness. Through teletherapy, she helps clients of all ages overcome tongue ties, TMJ disorders, sleep apnea, grinding, anxiety, and various breathing and co-facial dysfunction. She is passionate about education and self-help. Karese accomplished How to Sleep Better, Eliminate Burnout, and Execute Goals. When she is not working with clients globally, she spends time with her husband and 4 kids. Karese is going to share with us about healthy breathing, myofunctional therapy. Hi, Karese. Welcome to the show. Thanks so much for joining us.
Thank you for having me. I'm so excited to be here.
Thank you. So I'm excited to learn about myofunctional therapy. So we're going to get right into our first question. How did you become a myofunctional therapist, and what is myofunctional therapy?
Okay. So my story is a little long, so just hang in with me. I promise it's worth it. I came into the field through my primary licensure. So as a registered dental hygienist, I was working with a pediatric dentist who was very much into airway and breathing and how all of that affects our health. And I'm a parent of 4 children, and my children were much younger at this time. This is like almost 10 years ago. But they were very young at that time, and they were going through a lot of different things. And I like to say that as parents, we tend to only give the highlight reels when people ask, how's everything? They'll talk about this one's in soccer, or this one has a dance recital, and everything's great. But I had a lot going on in my home that most of us do experience, but that nobody was ever talking about. So very rarely was I sharing that with anyone. But my son, who is my oldest and my only boy, he had a lot of issues with emotional and behavioral impulse control, focus, attention, very typical ADHD case. My daughter, who is my oldest daughter, I should say, had every sleep issue under the sun. I mean, you name it. And for 10 years straight, we were guaranteed bedwetting, but with some sort of combination of something else. So whether she was sleepwalking, sleep talking, tossing and turning, falling out of the bed, grinding her teeth, I mean, it was relentless for a full decade. Then my youngest 2 daughters, they struggled a lot with upper respiratory illnesses. So whether it was the chronic sore throats and then the ear infections, and it's going back and forth all the time to our pediatrician, it was just very commonalities, I'm sure, that I share with a lot of families who have children, but none of it was actually normal. Like, this stuff should not just be occurring and we're just kind of passively letting it go by. And it was my pediatric dentist that really brought that to light for me and shared with me that a lot of, although what it was that they had looked very different, whether it was sleep or breathing or the ADHD, it all came back and stemmed from a root cause in how they were breathing, how they were using their oral facial musculature. And once I started to see the changes in my children, like, I dove in deep and I really became very passionate for helping other people. So that's how I got into the field. Okay. Myofunctional therapy, I like to compare it to personal training. So it's kind of like having a personal trainer, but for all the muscles below your eyes, but above your shoulders. So I work with all the muscles in that region to help strengthen, coordinate them, and to help facilitate better breathing, chewing, swallowing, and sleep.
Wow. Thank you for sharing your story, because I know that that resonates a lot with my audience about when you said how this should not just be normal. This should not just be something that just happens and then how you consulted with your dentist, right?
Yes.
and then you figured it out. And then that's how you got into the field of myofunctional therapy. Now, can you explain to us when you say that it works above the shoulders, but below the nose? Was it?
Below the eyes, above the shoulders.
Okay.
Mhm.
Okay. Can you give us some examples?
Yes, absolutely. So all of those muscles control various things. A lot of it has soft tissue that surrounds very mobile and very influential aspects of our jaw. Okay, so our jaw, our upper arch, the floor of our nose is actually the roof of our mouth. It's one shared bone system. So a lot of respiration and how you are able to manage your sinuses and even to facilitate clearing out your ears and that middle ear, it all drains down into that same system. So that palate, which is the roof of the mouth, matters a lot. The jaw, very important. That's the anterior, like the front and side borders of our upper respiratory tract. And it is really influential as far as its position and how much we're able to intake as far as oxygen. So all of these really important skeletal structures are surrounded by all these soft tissue muscles. There's over 100 muscles. Granted, many of them are in pairs, and so we're counting them twice, but there's over 100 muscles in that area where I work. And so all of these muscles and the soft tissue pressures that they apply daily on our skeletal structure is what is creating an influencing factor on how we're able to function daily. And we know that breathing is a primary function. We
Yes.
can go for weeks without food. We could go for days without water, but not
Mhm.
many of us would last more than a few minutes without air. And
Yes.
so oxygenation and how we're able to respirate, all of these muscles are supporting that. That should be the primary objective that we have in life, is to ensure that that area is as healthy as possible.
Okay. You just gave us a lot there. So
Mhm.
I'm going to see, I'm a 1970s baby. And so when I was in high school, early years of college, I used to grind my teeth. And so before there was myofunctional therapy, I had my dentist made me a mouth guard that I had to wear at nights so that I would not grind my teeth. And so would that have been a situation that I might have benefited from myofunctional therapy?
Absolutely. So we can think about a mouth guard as really protecting the teeth more
Mhm,
so than preventing the behavior, right? Because it
mhm,
didn't teach your body what to do. It didn't help you understand why exactly you were grinding your teeth.
mhm.
And trust me, as a dental professional, I understand how important it is to protect the teeth. But in addition to protecting the teeth, myofunctional therapy goes the extra layer. So our thoughts and the hypothesis currently around why grinding happens,
Mm.
particularly at nighttime when people are
Yes.
sleeping and unable to control it, is that that is the body's way of opening up the airway. So again, our lower jaw, our jaw is the front and side borders of that upper respiratory tract. If you were to take in a deep breath through your nose right now, and then breathe out, and then move your jaw forward, and you take in a deep breath through your nose, you'll realize that you get more air. So
Wow.
it's your body really managing, because that's a primary objective. We got to breathe, right? Sleeping, awake, you got to breathe. So the body is trying to manage your ability to intake oxygen by moving that jaw forward.
Mhm,
And so myofunctional therapy, where that really comes into play, is that a lot of those tissues in the upper respiratory tract, so in your throat and in the nasal passages, the first stages of sleep, everything's going to start to relax. All those muscles start to relax. When you're lying down, you have the added pressure of gravity now on top of you. So you've got relaxed muscles and you've got gravity, and everything starts to kind of close in. And the only way to keep it open, honestly, is by having really good strength in those muscles. That way, when you lie down, even gravity can't impact it. A great visual is actually thinking of somebody who has six-pack abs. You take a person with six-pack abs, well-defined musculature, and you lie them down, everything sits perfectly still. Nothing moves, right?
mhm.
You take somebody with a beer belly and you lie them down, that beer belly never looks the same. Between gravity and everything just
Yes.
kind of shifting, it doesn't look the same. So you can imagine those muscles, because all muscles throughout the body, no matter where they're located, everything can only relax and contract. So
Mm-hmm.
those six-pack abs are in constant contraction. But you imagine that those muscles in your throat now are like those six-pack abs. When they're strengthened, they are able to maintain the solidarity that it needs for oxygen to pass through appropriately.
Wow. For those of you that are watching, I was trying to do that exercise as she was explaining it to see the difference. Thank you for that. You also mentioned about the ears. Does myofunctional therapy help with the ringing of the ears?
Yes.
Okay.
So it is primarily called tinnitus, right?
Mm-hmm.
And it is very common. A lot of people experience that. So our palate, the roof of our mouth, I mentioned earlier,
Mm-hmm.
our tongue actually at rest should be lightly against that palate, suctioned in its entirety. So all the way through from just behind our upper front teeth through the back towards the throat. That tongue should be all the way up. That pressure that it applies at constant rest and then in occasional spurts when we are swallowing actually helps to drain out our eustachian tube. So that's that middle eardrum tube where all the fluid tends to sit and settle. It helps to drain it. So you'll figure that if you're on a plane, the next time you're on a plane, the really best way, the best trick that I can give you to help to clear your ears so that you can really feel it is to put your tongue up against the roof of your mouth and swallow. And you'll feel that
Wow.
pop right away, clear the ears, because that pressure there is going to drain that tube. And that's what's happening all day long when you have good tongue posture.
Okay, so notice how I'm asking you because once again, I'm a 70s baby and we did not have myofunctional therapy when I was coming up. And so I had to deal with the grounding. I don't do it much, maybe rare every now and then, but I'll be trying your technique for when it does. Because sometimes at nighttime, I can feel when I clench my teeth and I just automatically release. But it's not as bad as it was during my high school and early college years, especially, like you said, sleeping at night. Now, every now and then, the ringing of the ear. So that's the specific why I was asking you that, because I've experienced the ringing of the ear and I really wanted to know it's a common thing, but it's not a common thing, if that makes sense. And,
Absolutely.
and so that's why I was wondering how could myofunctional therapy help with the ringing of the ears? You helped us with that by giving. Now, next time I'm on a plane, I'm going to try that, put my tongue to the roof of my mouth and breathe. I'm going to try that. Now, my next question is because since moving to Phoenix, Arizona, I have allergies now that I never had before. And you also talked about how myofunctional therapy helps with below the eyes and above the shoulders, right? So how does myofunctional help with allergies?
So myofunctional therapy is very focused on conscious awareness. So one of the things that I do really bring to the forefront with a lot of the people that I work with is diet, because diet has a big role in inflammation. Any sort of inflammation in that upper respiratory tract is going to make you more sensitive so that your histamine will just produce because you're already at a sensitive level. So your body is trying to protect itself essentially so that you can continue to breathe. So diet is a big part of things, making sure that you're managing your environment when you can. But next step is always nasal hygiene. That nasal hygiene, clearing out our sinuses, it helps to manage that histamine level and our ability to really regulate that inflammation that may exist in the nostrils, within the sinus cavities. And so if you don't have a nasal hygiene routine, like a daily consistent routine, please start one. So that would consist of maybe saline sprays. You can do saline irrigation. Don't try to create your own saline. Some people do that. It's better that you just buy the saline. Saline is like a saltwater mixture, but with the wrong mixtures of it could just wind up being an absolute disaster that strips the nose, and you don't want that dryness and mucus buildup and so forth. So a saline irrigation or a saline spray and helping to clear all that out. But really having good oral posture and making sure that these muscles are really nice and well developed is absolutely going to help to keep it patent and decrease your inflammation over time. But that's always in conjunction with making those lifestyle changes.
I love how you said the saline routine, having that, the nasal routine, because I've been looking at different options and so forth. I have my medication that I take on a daily basis, the tablet and also the nasal, what do you call it?
The spray?
Yes.
Okay.
And that's from my allergy doctor
Mhm.
because I am allergic to certain elements that causes my nostrils to inflate. But I was asking, and you did a very good job answering my question about what is it that I can do as far as myofunctional therapy. And that's that additional step that you just talked about, because I have been reading up on it. I have been, there's a lot of different people that are offering different options to your nasal routine, cleaning out and so forth. And so you did a wonderful job answering that question. And I'm glad that you also recommended that no one try to create their own. So find one that you want to try out, see how it works for yourself. Is there anyone that you would specifically recommend? I'm not asking you to name drop or anything like that, but because you are the professional in this field, I have to ask because I haven't tried one yet, because of the simple fact that I'm not for sure which one is the best one to try.
Absolutely. I would recommend the irrigation systems or the sprays that have natural ones that you can buy over the counter, because the medicated ones also do tend to strip the nasal lining over time. But I would buy one that has xylitol in it. That xylitol is actually going to help more of it stay within the nostrils, moisturize it, and provide a nice little antimicrobial layer on top of the saline benefits.
Wow. Karese, thank you, thank you, thank you. So you have really helped me. I know that you have helped my audience because I've asked the very specific questions about the grinding, the tinnitus, the ringing of the ear, and then also, the allergies or the sinus problems that people may have. So let's get into your business. Okay. So how does your business, the MyoSpot, help people to breathe healthy and better? Now, you've given us a lot of good examples, but I want you to specifically provide us with information about the services that you offer, like the Myo process, the MyoSpot treatment, myofunctional therapy plans, online courses and instructions, your tongue ties, tongue works, methods and affiliations. You gave us some. See if you can give us a little bit more, and how you provide for medical and dental referrals, and also about your Myo on your own self-guiding healing. Now, I know you can't talk about all of your services, but just pick the top ones that you can share with our audience.
Okay. Yes, I was just going to say that's a lot. So, yeah,
well, you do a lot, and you do it very well.
My myofunctional therapy services are absolutely varied. The biggest thing for me is access to care, which is why I have so many different things available, because not everybody can afford to work with someone one-on-one. And we're in the digital and the information age where you can go on YouTube, you can go look up some myofunctional therapy exercises, and you can mess yourself up. Okay. So I'd rather it be done in a more guided way. So I have a lot of different options for that reason. My most traditional path is going to consist, I offer free consultations. So I will talk to anybody at any time about myofunctional therapy. That free consultation is really going to break down what's your history. So like you've said, you've experienced the clenching, the grinding, wearing the mouth guard, the allergies, and really you're trying to figure out how all of these pieces fit together. I would have a conversation with just about anybody who fills out and schedules online. I would have a conversation with them about what's been going on with them, and if myofunctional therapy is a good fit for them. What does that process look like? What are their particular options? For some, I'm not the first person that they should see, which is why I talk to everybody for free, because I don't want to, take your money and I can't help you. Mm-hmm. So the next step, if myofunctional therapy is the next step for that person, it's what kind of method is it going to go? You could go the full working with me one-on-one, which always starts with a comprehensive evaluation. I'm going to look at all of these muscles and I'm going to figure out and pinpoint where's your asymmetries, where's overdeveloped muscles, underdeveloped muscles, and compensatory patterns. And then I'm going to create a custom treatment plan so that we can work one-on-one to figure it out. If you have more of a simple case, often I direct them to the on your own. So I have a book, I have a journal, and I have a course. So they could go any one of those routes, various price points, obviously, between books, journals, and courses. But that is going to help them to get on their path in a way that they can afford and a little more simple, straightforward. So it's not as catered and personalized to you. But if you have a simple case, it's super effective. Um, let's see, I use various methods with a lot of my myofunctional therapy. So myofunctional therapy is amazing and wonderful, and I love it. But there's so much more that we could do in conjunction with it. So I work with cranial nerve integration, making sure that all the nerves are functioning well and efficiently. I do rhythmic movement, voice gym, breathing, a lot of various breathing techniques, and energy work. And so all of that really comes together beautifully for a more holistic, rounded wellness approach to addressing all the upper respiratory issues that could potentially manifest when you're not breathing correctly.
Wow. So for all of you that are tuning in, she does a complimentary. I like the word complimentary because there's value to what it is that you're doing, even though they don't have to pay for it. So she offers a complimentary consultation, and she'll determine based on that complimentary consultation on what's the best route for you to take. So if it's more of a one-on-one with her, or if it's more minimal, you can do a guided program, but it's still her that's giving you those tools in that guided. So remember that she said, Karese had shared with us, she said that don't go at it on your own. So even though you might be able to do her guided, you're still not on your own because she's providing you with the resources that you need to be successful. So with that being said, Karese,
Yes.
I've learned a lot about myofunctional therapy, and I hope my audience has too. This is awesome. I wish I had it when I was growing up. Do you get that a lot, Karese? Because I'm a 1970s baby.
All the time, all the time.
Wow. So, Karese, I have to go back a little bit. How has the myofunctional therapy helped your children?
So myofunctional therapy has helped my children in various ways. We'll go back to my son and his symptoms of ADHD. It really turns out that after a couple of years that we spent medicating him, going through different medications, and nothing was really helping him, that ADHD that he was diagnosed with, it wasn't actually ADHD. So we have to
Wow.
remember that ADHD is a symptom-based
Mm-hmm.
diagnosis. So if all the symptoms line up, that's what they're going to call it. There's no blood test you can take, no MRI that can find it. There's nothing that's going to say that's exactly it. So the actual issue he had was he had a sleep breathing disorder. And that actually has a 70% overlap. So children who are not getting good quality sleep, so his issues didn't manifest in the way that his sister did, where it was very overt, but
Mm-hmm.
he was not getting good quality sleep and a lot of deep stage sleep. And that actually has 70% overlap with the symptoms. So sleep deprived children manifest very similarly to ADHD.
Mm-hmm.
And those things are very commonly misdiagnosed. And it was very interesting for me when I approached that topic with his pediatric neurologist and said, we're not going to go try a fourth medication. We're actually going to go down a more natural path because his sleep wasn't well. And she looked at me and she said, well, why didn't you tell me that he wasn't getting good sleep? There's a overlap. And she started to explain to me what I already knew by that point.
Wow.
But we had been working together for almost 2 years, and she never once
You
asked
never
me about
said it.
sleep. Never once. Never once.
Wow.
So my son is like night and day. Back during that time, he was in fifth, sixth grade, just about. And now he is 19. He's about to be 20 really soon. But 19 years old, he went from not being able to really focus and was not doing well in school at all to being the child who at 17 years old, he graduated a year early ahead of all of his peers. So this
Wow.
brilliant child was so hindered by his inability to sleep that it completely impacted his learning and his school performance. But here we are, and it's like night and day. And so I'm incredibly grateful for him. He's my biggest success story.
Wow.
My daughters are also night and day. We haven't had any sort of antibiotics and no upper respiratory issues in my house for the last 5 years. So I'm incredibly happy. And that's us going through COVID as well. But outside of the sleep issues and my daughter being completely resolved, we stopped the bed, like no more bedwetting, which was like a godsend.
Yes.
No more bedwetting, none of the sleep issues, none of the snoring, none of the falling out of bed, the sleepwalking, the sleep talking, all of that was resolved. And so it really does look like a completely different household by just us being able to manage how they were using their oral facial muscles.
That is wonderful, Karese, just wonderful. I would actually recommend that parents contact you when their child has been diagnosed with ADHD to find out whether or not it's really myofunctional therapy that they need. So with that being said, Karese, we're gonna have to wrap up pretty soon. So take a minute to two to tell us, how does sharing your story today help us? Share the work that you have done or doing to bring about change. Tell us about your current and future plans for the Myo Spot. 1 to 2 minutes.
In my future plans for the Myo Spot, I really envision creating a foundation that we have a world where we can get this word out. Myofunctional therapy has actually been around for a century, and we haven't really gotten much momentum except in the last 5 years or so. So I really want to promote as much education as possible. The biggest thing that I have as advice for people, if you feel something is wrong, I knew something was wrong with my kids, but I was just following the medical system. If you feel like something is wrong with yourself, your children, a loved one, please advocate for yourself. Advocating for yourself is going to be the best way for you to find the resources and the help that you need. Do not stop and give up on yourself. You can find help. If you're looking for or interested in myofunctional therapy after hearing all of this today, please go straight to my website, themyospot.com, where you can schedule a free consultation or even just learn more. I've got lots of free resources there.
Well, thank you so much, Karese. And I will also put your link also on this podcast so that people can be able to click on it and go straight to you. Thank you so much for joining us today, Karese. This was so educational and awesome. I love the exercises. I love the examples. You are a professional, honey. I mean, I felt like I was in one of your consultations and you were just breaking it down for me. Try this exercise. And so that lets me know that anyone that comes to you, they're going to get the same type of service in your consultation to really address their issues. Thank you, thank you, thank you so much, Karese.
Thank you.
All right. Next week, we'll continue to discuss and have conversations about real experiences, personal and professional, stories that need to be shared, seen, and heard that makes us human. The truth will not be silenced. To be seen, to be heard, to be human. The surprise. If you like or leave a positive comment about this show, you'll get a shout out. This includes businesses. It could be for products and services, organizations, and events. Following the link in the show notes lets Buzzsprout know we sent you and help support our show. Buzzsprout is the best way to launch a professional podcast. Want to ask a question, be a guest, or subscribe to this podcast? The truth will not be silenced. Click on the show link. Thank you so much for joining us.